Look, this pandemic has changed the way a lot of us do pretty much everything, right? Including how we care for our pets. There's a way to do most of that routine care at home as well. Joining me to chat more about options for you and your cats and dogs is Ready Vet veterinarian Dr. Nancy Turner. Thank you so much for joining me today.
Hi, thanks for having me.
Now, Dr. Turner, you guys are offering something that really caught my attention, in-home care for your pet. So tell me what types of services can be done at home and why do you think people are sort of going this direction?
Yeah, so I would probably say about 80% of veterinary care can be done in home. The main things that we have been taking care of are things that you would regularly go into your vet for. So vaccinations, blood draws, ear infections, skin infections, vomiting and diarrhea, all those things that you would normally have to take your pet in for, we can come to you and take care of them in the comfort of their own home and your own home. And I think that that's probably the main reason that people are interested, is because they don't have to go anywhere. And the pet is more comfortable and they're more comfortable. And it's, you know, we say that they're trading their living room for the waiting room, and we think that's a pretty good trade-off.
So Dr. Turner, what's the difference between in-home and in-clinic pet care just in general?
Really, the only thing, the standard of care is exactly the same. You're getting the same physical exam, the same ear, exam, the same eye exam, the same orthopedic exam. The main difference is going to be the stress level of the pet, which I have experienced a significant drop in that anxiety, which leads to better, exam results and things like that. Obviously, there are some things that we would want to take care of in a clinic, like wound repair or lacerations or x-rays and things like that that we would want to do in a clinic. And we have our clinic hubs to do that as well. So we have access to all those things, but there are definitely some limitations. You're not doing anesthesia at home. That's definitely not safe or recommended.
Yeah, what are some things you cannot do in homes? I mean, you started to mention them. I'm wondering if there's anything more serious.
Yeah, I think that if your dog is experiencing some pretty significant bleeding of any kind, that would be something that you would want to take to a physical clinic, whether it be ours or someone else's. But otherwise, I definitely think the majority would at least be like a screening done in home and then referring to a place that would be able to handle it as efficiently as possible, which is really the goal, is to get the pet feeling better as soon as possible.
And, I don't have a cat or a dog, but I think I've talked to so many of my friends that say, like, look, with people being home more, generally they're spending more time with their pets. That's led to people paying closer attention to their pets and more quickly identifying medical problems or any sort of issue that comes up. Are you seeing a lot of cases like this?
Oh, totally. Okay. I think it's been really, really nice, honestly, from a veterinary standpoint, to be able to catch things so much earlier. So like skin infections and ear infections and dental disease and all those things that are a lot easier to identify when your dog is with you or your cat is with you all the time and you're suddenly wondering why they're scratching so much or why their breath smells so bad or things like that. So I definitely think, and it's been really nice to see that kind of attention to detail that we're noticing. Lumps and bumps we're finding sooner, a little bit of lameness or maybe some change in appetite. All those things we're seeing sooner rather than later, which is really nice.
And Dr. Turner, this last question not meant to be funny. We have like 10 seconds, but do you find that cats and dogs are noticeably behaving differently because of the pandemic and sort of the changes that they've encountered?
Short answer, yes. Stress will bring out a lot of things in cats and people and dogs, medically wise. And so we've definitely seen some uptick in stress-related illness like viruses in cats or diarrhea in dogs or urinary issues in cats as well. So yes, short answer is yes.
Oh, wow. Thank you so much. This is so insightful. And I know a lot of people, love their pets. They're part of their family. So we certainly appreciate your time today.
Thanks so much.